There is still a lot of arm twisting underway this morning. We're just a few hours away from the vote on health care.
Yeah, we're going to go to Washington right now and talk to Brian Bilbray, one of our congressmen there. Representative Bilbray from the 50th District is on the phone with us. What a time to be in Washington, Congressman. This has got to be a time when, of course, it's frustrating for Republicans who feel they've been shut out of the process. But at the same time, in a way, history is going to be made, good or bad, right?
Good or bad. I mean, and, feel like shutout is sort of interesting because this would be the first time that a major piece of legislation like this that has huge social impacts is totally a one-party proposal. There is not one member who involved in this that is not part of the Democratic caucus. And so I don't think we've ever seen this in the history of the Republic, that one party has so much votes and so much power that they can do this without even sitting down with the other side. In fact, they can lose 37 votes among their Democratic caucus and still be able to push this thing through.
Yeah, and we're getting word this morning, Congressman Bilbray, that they do definitely have the votes to pass this.
Well, we'll see. We don't know exactly on that because I know that Stupak and his group went to the White House, and the president's making a lot of promises about executive orders. The trouble is with executive orders is they can change, but this bill, if it's passed, will not, can't be changed unless there is a change in the White House and a change in the House and the Senate and a 60-vote majority in the Senate. So we're really looking at something that, if it passes today, will be locked in unless there is a major, huge shift in the political process that we have not seen in probably 60, 70 years.
Congressman, your leadership on the Hill has said that the Republicans can't stop the vote, but the American public can. And on this Sunday morning, now that we're just hours away from the vote, if a member of the public strongly still feels this is the wrong thing to do, what should people be doing this morning? Is there still a chance to stop it if you feel it needs to be stopped?
Well, I'll tell you something. What's been going on is that the voters and the citizens have been what we call frying the phones. They are calling so much that it's overwhelming the phone system, and basically all the congressmen are hearing is an overwhelming majority of saying, why are you pushing this so fast? Why can't we sit down and read this in the next 2 weeks during a Easter break? You're not going to be here anyways. And those calls are coming in. In fact, my office has been open, will be open again today just to be able to take calls. But the other issue that San Diego's got to understand is, except for guys like myself who were born and raised there, the overwhelming majority of us all come from somewhere else. And call your relatives, call your family out of state, and have them call their congressman and tell them what they think, because this is a major issue. And to be able to pass it today, if it is passed today, we will be spending 60 years trying to fix this up, because they always say, well, let us pass this and we'll go back and correct it. How many times you've seen how long it takes to correct things? And the fact is, they admit that this thing's been in the works for decades. And frankly, you and I will see old age come and go by the time we see this thing corrected.
Congressman, we spoke to Congresswoman Susan Davis earlier in the week, and she said her constituents have been calling her and saying that they want her to support this bill.
Well, look, after retired military, if they want to have their TRICARE shifted out of the military and over to a social service section, and rather than having the TRICARE, their health care operated by the military who they trust, I think that she's got to take the time to read the bill and take a look at some of the stuff in this thing that is absolutely extraordinary. And remember, this bill also, contrary to what people were saying, opens up totally that people illegally in the country do not have to pay the tax, but all they have to do is give a phony Social Security number and they get in, because this bill doesn't have the same verification that every other social program in this country is required to have, and doesn't have E-Verify. They basically sort of custom fit this so that certain special interest groups can fit into these things.
Well, whether you're in for it or against it, there will be some kind of history made this morning in the Capitol building. And, Congressman, you're going to be there to witness it. We're going to be checking back with you all morning long. Please keep us up to date what's going on. Give us your perspective on this day on Capitol Hill that could change the history of this country. Certainly will, one way or another. We'll talk to you probably next hour, Congressman.
Absolutely. In fact, I'll be talking to a couple of my Democrat and Republican colleagues so I can give you a perspective from both sides, and I'm sure Bob Filner will have a lot to say about this.
I'm sure he will.
He's been pushing for the single payer for a long time.
All right. Thank you very much, Congressman.
Thank you.
All right.